Welcome back to another Children's Health Andrews Institute lecture series. My name is Jacob Rivera, and I'm the performance manager for our EXO sector. And our role here is to act as part of the continuum of care for the athletes and clients and patients here. So we do sports performance training for multiple age groups from as young as 7 years old up through college, professional, etc. What I've spent a lot of time working on for the past 7 years is how we can create a model that best suits return to sport. Working with ACL specifically in ACL reconstruction has been more of my niche, and also one of our lead PTs, Stephen LaPlante, and I have really built up this program over the past year. And ultimately, what our goal is to create a more solid continuum of care from when an athlete goes through surgery to rehab to performance and in the field. I come in more on that performance side, of course. And my job, once they finish physical therapy, or they could also be in physical therapy, it just depends on the situation. My job is to get them to return to sport safely, be prepared to do so, essentially create a training program that allows for progression over time, leading to their success, leading to not ever coming back for that same injury, or let alone a injury on the other knee or anything like that. So really the focus today is I'm personally trying to take a step away from just focusing on ACL reconstruction. I'm trying to take more of an approach of how do you think about this approach with any type of injury that you're working with? So it doesn't matter if it's ankle, it doesn't matter if it's knee, it doesn't matter if it's hip. How can you apply a very similar progression over time to allow for somebody to be successful going back to sport? For the overview, we're going to focus on what does that bridge model look like? What does that bridge model mean? And how do we utilize that in the context of our setting, especially our interdisciplinary setting? We're going to talk about this concept of spectrums. Where I'm trying to go with that is that spectrums really allow for athletes across spectrums, right? Across age groups, across abilities, across different timelines from surgery, or really abilities for that matter, is how can we split them up via plyometrics, via speed, and via agility. What you'll learn about our program is that we'll have multiple athletes with different injuries. We'll have multiple athletes that have different situations going on, and I have to fit them within a specific space, a specific zone, a specific spectrum that allows for that athlete to be successful and also not overexpose them to something that's unsafe. So for those that are listening, from a plyometrics standpoint, what I'm speaking about is things like box jumps, hopping, bounding, or different type of jump activities that you can do within a program. I also will work with these athletes on speed and agility. So of course, strength and conditioning is all mixed within this. I'll cover that near the end. But from a speed and agility standpoint, I'm talking about sprinting, and I'm also talking about change of direction. So certain athletes, depending on their timeline from surgery, will ultimately fit differently, right? An athlete might not be able to run yet. So what do you do with that athlete? An athlete might not be able to cut yet. What do you do with that athlete? Now, within this 45 to 50-minute presentation, I might not cover every single thing that we do, but I'm trying to really whittle it down to the very simple principles. Talk more about that as we go. This lecture was built originally to include a hands-on practical component. And so I'm instead doing some videos that you guys can see that would be a part of a typical practical. But typically, like I said, we would do a lecture and then we would also do a hands-on perspective. You'll see kind of these different progressions come to light via the videos. The key points today. When it comes to returning to sport, we understand that sport itself is chaotic. We understand that at any moment, at any time in a game, people need to move rapidly, side to side, change directions, cut, run. There's fatigue involved. There's contact involved. There's all these different things that we really have to be able to prepare the body for. So part of my training program is, how does an athlete enter into chaos and be successful? So between the rehab and the performance side, before they're actually going back to sport, have I prepared them for chaos? That's the question that I always have to ask myself when it comes to my training program. Have I prepared them for the fourth quarter or the third game in a 3-day tournament to help prevent that injury? Now, we know that injury prevention, of course, is a myth, but we always want to think about what are the ways in which we can reduce that injury and the likelihood of that. Now, hopefully, what you can gather from this presentation is that this is a model that you can apply to almost any injury. Like I said earlier, I'm trying to step away from just focusing on what it's like to work with ACL reconstruction athletes and that kind of return to sport timeline, because really what we've seen is that the way in which we attack the training for these groups, very, very similar, irrespective of the injury. Now that might give you a moment of pause of like, oh, like you're not specific to the injury. It's like, yes, of course we are. But at the same time, we've got to also be able to bucket these athletes in certain groups that helps us to more simply categorize these athletes. Now these progression spectrums of plyometrics, speed, agility, and also strength exercises, they help you to manipulate the environment, okay? They help you to manipulate the variables that allow the response to that training to then lead, hopefully, to that injury prevention in the future. But really, as a strength coach, my job is to manipulate variables to create a specific stimulus that then elicits an adaptation over time. What strength training is essentially controlled trauma. It's controlled trauma that allows the body to break down, heal, recover, and then become stronger. That's how we build muscle tissue. That's how we build back the tendon. That's how we build back strength in the ligaments and things like that. So ultimately, I'm trying to manipulate that environment while also ensuring that the acute to chronic workload is in your favor. So what in the heck do I mean about the acute chronic workload? It's as simple as this. If I'm training for a marathon, and the farthest that I've ever run in my life was a 5K, 3 miles, right? If I had only been running 3 miles, and then all of a sudden I decide I'm going to do a 10K this weekend, it's going to be awesome. I might make it through that 10K because I haven't reached my breaking point. And maybe my calves are sore, or the knees are a little bit, angry with me. I could probably survive that. But if I had only been running 3 miles, and then I decide to run 13, my body is not only going to be really angry with me, it's probably going to be injured in some way, shape, or form. So what we think about with the acute versus the chronic workload, what we're saying is, what you've done in the past like 2 to 3 weeks, I would say, relative to what you've done over months. So it could be a month, it could be 6 months, it could be 12 months. That ratio needs to be very specific and it needs to be very controlled. So the ability for us to identify what acute workload is appropriate based on the injury, based on what's going on, that's going to allow us to build up that chronic workload over time that allows for that injury resilience. So let's take the lens of focusing on the ACL injury mechanism. So from here on out, I'm going to try to focus on the ACL injury mechanism. And then as we go, hopefully, once again, continue to see how this can be applied differently. But ultimately, if I was thinking about the ACL injury mechanism, I could also think about the rotator cuff tear injury mechanism. I could think about the meniscus tear injury mechanism. I could think about the shin fracture injury mechanism. There's a multitude of things that you can do. They all are going to have some sort of injury mechanism. In this case, a typical ACL non-contact, or it could be contact, right? Injury mechanism is going to involve femoral adduction, knee abduction, dynamic valgus, ankle eversion, and overall a trunk deviation that essentially falls to the midline. This is how the typical ACL happens. Now, it could be PCL, it could be MCL, it could be a multitude of things. Ultimately, we typically will see that really aggressive rotation. And as you can see, Robert Griffin III here probably experienced, I think it's his third or fourth ACL reconstruction on that side. And fortunately, he got injured on this play, but typically we see that same mechanism. So this then becomes my blueprint for how I think about my training, because I need that to not happen on the field. I need that to not happen when people are running. I need that to not happen when they're changing direction. I need that to not happen and them have the strength to prevent this type of situation. Now that's, as I've said before, not going to be perfect all the time, but I have to keep this in the back of my mind, especially through the rehab process and the performance side. I have to be really careful about when I start to see this mechanism during a simple drill that we do, I need to make sure that I'm correcting for it and make sure that I'm addressing that with these athletes. Now, once again, by trade, I'm a strength and conditioning coach, so I'm not ever doing physical therapy or rehab, but oftentimes, once they're actually referred to us, they may still see their physical therapist once a week. So I'm always going to have a little bit of hands in both. I need to know what's going on in the rehab side, and I also need to know what we're doing on it. Now, I'm going to talk about what I would consider to be the principle of principles. I would say if we can accomplish these three things and understand these three things, we're going to do a really good job of preventing the injury. So a simple example is to think about when an injury happens. Well, when an injury happens, typically the capacity to prevent that injury, or at least the capacity to not be in that position, is not currently there. They don't contain that ability. And also the external load of that situation, whether it was the contact force, whether it was the landing force, whether it was anything that created that injury, that exceeded the actual capacity of the athlete, the capacity of the body to handle that load. That's typically when injury will happen. But when the load is very specifically less than the capacity of that athlete to resist that load, or at least absorb that force, then that's going to be something where we're trying to control that, right? That's going to be something that we're trying to do both on the rehab side and also on the performance side. We're managing that acute workload, right? We want to keep that acute workload not beyond their capacity, because that's when we can get re-injured, right? And we're not allowing for the healing process to happen. But what I will say is that as the capacity, and it is in excess to the amount of load that I might incur in a game, in a football game, in any situation in life, that's how I prevent the injury. Capacity, once again, it could be broken down in a multitude of ways, from the amount of strength that an athlete has, the power that they have, the endurance that they have, the stamina that they have, a multitude of things. But our overall goal is to improve capacity beyond the external load that they might incur. This is not my own quote. This is from Dr. Andrea Spina. He is somebody that founded functional range conditioning. Really great program for mobility and these different things. And this is definitely a slide I've taken from him. Now, what does a blueprint do for us? Well, the blueprint is how we draw up the design of what's going to happen. The blueprint does not dictate what happens in the construction process, because ultimately, every once in a while, you have hiccups where things need to be changed. But when I think of blueprint, I think of a blueprint that allows me to have specific spectrums, specific programs, specific areas where this is what my starting point's going to be. And then from there, I have to get the feedback from the athlete. I have to get the feedback from the environment. I have to get the feedback from the situation. And how do I adjust for that? So this blueprint that I'm talking about is going to involve the spectrums, and it's going to involve the different charts that you're about to see. What I've tried to do is I've tried to outline what that plyometric progression looks like for our athletes. within my own programming, within our own program design, how do I utilize plyometrics in a progressive way over time? Very similarly, how do I progress athletes back to running? And where's my starting point? Where's my end point? Very similarly, for our strength training program, we're not going to be sharing like a template. I have some examples, but ultimately it's going to be a template for how do we progress athletes through ACL return to sport specific. Now, the reconstruction process for ACL, especially after rehab, is going to be a quite extensive process. It's typically going to be a 12-month process. And I typically will space athletes between phase 1 and phase 4. So what does this concept mean? Well, phase 1 is going to be typically what I utilize in my programming, in my program design. Or what would I do with an athlete that is 0 to 3 months from surgery? Now, depending on who's listening, hopefully we all know and all understand that just because somebody's 3 months from surgery doesn't actually mean that they've earned something. It just means that we know how far out from surgery they are, and generally what's the risk relative to what we're doing. Now, once again, this needs to be individualized. It needs to be controlled for, and not everybody's going to fall neatly into these categories. You'll see that 0 to 3 months is phase 1, 3 to 6 months is phase 2, 6 to 9 months is phase 3, 9 to 12 months is phase 4. And so what is this bridge concept? What does that return to sport look like between physical therapist and strength coach? Well, in rehab, they may or may not work with a strength coach like myself, anywhere from no times a week to 1 time a week. If we were doing anything less than 2 months from surgery, what we would typically focus on is just upper body. No risk to the lower extremity. We're just focusing on upper body. We're just focusing on core. Typically at this point, they'll be with their PT 3 to 4 times a week. So the PT is the main driver of that process. As we get to this zone 2, phase 2, what this is going to start to look like, I would say typically I receive most athletes 4 months post-surgery. And usually at that point, they're not in physical therapy. Some are, some aren't. It just depends on the athlete. But this bridge concept is going to be where now we're sharing the athlete. We are literally sharing the athlete, where they'll see me 2 to 3 times a week, and then they'll see their PT 2 to 3 times a week. Now we have to make smart decisions, of course, on, hey, you're doing this, what am I doing, right? You're using these progressions, what progressions am I using? You're using these running drills, well, what running drills should I be doing? So there's a very symbiotic relationship that I'm having with the physical therapist about how this athlete's progressing. And of course, you have to make sure that we're allowing recovery for the athlete as well. So there's going to be times where the PT is going to back off the gas pedal and put more recovery and more focus in that. And then this strength coach myself is going to put more on the gas pedal, and vice versa, right? If they did a really hard workout in their rehab, maybe they're, I'm putting more on the brakes, easing my foot off the gas pedal. So this program is going to be pretty shared, like I said. And then as we move into phase 3, what's going to happen is I'm becoming the main driver of what's going on. So between this sort of 6 to 9 month range, I would say most athletes feel pretty darn good at that phase 3 point. He's not swollen anymore, their knee's not aching anymore, they're running more, they're changing directions more, they're doing these different things. And that's where performance training really starts to take off. They might only see their PT 0 or 1 times a week. And then ultimately, I put sport coach in here because a lot of these athletes need to start working with some sort of skills coach. So if it's volleyball, soccer, basketball, it doesn't matter. They're working with a skills coach to help them kind of return back to those types of sport-specific movements in a way that I can't really do, right? Like I have a field turf and a weight room, but I can't necessarily, go out and shoot hoops, right? So I have to make sure that there's a sport coach involved somewhere that understands their restrictions, And as we enter in phase 4, the PT will primarily have his or her role in return to sport testing. And they're going to be seeing me anywhere from 2 to 5 times a week. And once again, working more specifically with their sport coach. And then at some point in phase 4, they are back to sport. They are back in tournaments and games and scrimmages and things like that once they've been cleared with their doctor. So this is what we mean by the bridge model. Now, very simply, can you go back and do the same thing for any other injury? What does the return to sport phase 4 typically look like? What's that range look like? When was the surgery date? How could you phase 1 after a shoulder surgery, for example? Right? With some of the athletes I've worked with that have had surgery on their shoulder, we might be doing planks in phase 1. We might be doing a simple Y or T or W drill in phase 1. Maybe we're just doing lower body, right? Phase 2, we start working in things like kettlebell carries, a bottoms up carry, an overhead carry. Maybe we're working into push-ups, things like that. You can take this process, break it down based on any injury. That's my hope today, is that you understand that any injury can be utilized this way. You just have to understand the process. You have to understand, how do you work backwards from that? Hey, sport is chaos. How do I work backwards from there relative to that specific injury? Now, I'm not going to go deeply into this, but what I can say is that based on the injury mechanism component, most likely you can identify an underlying neuromuscular imbalance that that athlete has. So this was specifically taken from, once again, an ACL injury prevention approach in female athletes. And then based on that underlying neuromuscular imbalance, you can then create an intervention component. So the intervention is, okay, I've identified this in my evaluation process. I've identified this that led to the injury. What am I going to do about it? Am I going to utilize posterior chain exercises for the shoulder? Am I going to utilize isometrics in my strength training? Am I going to utilize single leg training in my training to target X, Y, or Z? Am I going to ensure that I'm doing core stability training as a way to help prevent the injury? Right? You could think of any sort of mechanism that then reveals an underlying neuromuscular imbalance that then highlights a targeted intervention component that actually gives you the opportunity, hey, what am I going to do with this athlete? Once again, you can do it in any way, shape, or form relative to the injury, and most likely you can create a very similar table to this based on what you've dealt with in the past from different injuries. Now, how do we actually accomplish this? How do we actually do this? Well, you have to have a system, right? The bridge kind of gives us the bridge model gives us an understanding of how does this work as part of an interdisciplinary team. But when I'm talking about being a strength coach and I'm talking about what I'm doing in my actual sessions, well, I have to have a system. You have to have a system. Everybody needs a system. What's the system for your rehab? What's the system for your surgeries? What's the system for your training? What's the system for your sport coaching? Right? We all need systems. Systems allow us to not only be adaptable to the environment, but they also allow us to be consistent. And also from an accountability standpoint as well. But that doesn't mean that it's rigid, right? Systems still allow for adaptability, and that's what this system does. So this is our Exos training system, and you'll see we kind of move through these different areas of pillar prep, movement prep, plyometrics, movement skills, strength and power, conditioning, regeneration, and recovery. These are the components that we've identified are really, really important when it comes to training athletes, and especially when it comes to improving an athlete's capacity to that injury. A simple way to kind of describe this system is there's really 3 components. Although you see 8, there's really 3 components. The first component between pillar prep, movement prep, and plyometrics is all about movement quality. Can I improve an athlete's ability to move well and move well at all of their different joints? And then the second part, the second tier to that is I need to build the engine for this athlete. I need to build the power, the speed, the stamina, the explosiveness in order to allow this athlete to have performance enhancement. And then on top of that, part 3, energy systems and recovery, that's allowing your body to continue, right? Continue performing well. Recovery, allowing your body the appropriate recovery allows you to literally improve your performance because you're not fatigued anymore. But then also energy systems, the more you train conditioning and the more you train your body that way, that's going to allow you to be resilient to fatigue, right? So if you're fatigued, you need to recover. If you are doing conditioning, you are improving your resilience to fatigue. But really what we're saying is that your ability to improve your force over time and your ability to maintain performance over periods of time. That's a simple way to break down the Exos training system. So, as said earlier, we have these different phases that we work athletes through. You'll see that phase 4 is not mentioned here. And part of that is because most of the time in phase 4, the athletes are essentially like exiting our program. So I would say the biggest bucket of our training and our bridge approach is going to be in phase 1, 2. It can very easily and simply be organized as the foundational program, the intermediate program, and then the advanced program. And these 3 phases are progressive over time. They help us to identify where an athlete fits along those spectrums of speed, ability, and strength training. It allows us to bucket athletes so that we know what they're doing, how they're doing it, and how to progress over time. Back to the system analogy, everybody needs a system. Our system for our actual training week. So this is what's actually happening on the floor, what's actually happening in our weight room, what's actually happening when we train athletes on the field and in the weight room. Well, we're going to have a coding system for this. We're going to focus on speed on some days. We're going to focus on agility on other days. We are specifically training movement skills because we want an athlete to be returning to running safely, and we know and can really train them on their ability to accelerate and also their ability to run. Well, also at the same time, we know that for field sports, we need agility. So we're going to focus on agility, and we're also going to focus on how do we change direction in a shuffle type situation and a crossover type situation. Now, the movement skills concept may be a little bit of a nuance for some of you. So when we consider movement skills, we're talking about speed and agility, but really we're talking about how do you move your body in space. Really, it's the ability that we can teach an athlete from a technical standpoint, from a know-how standpoint, while also exploring how can they respond to a chaotic environment. So that's going to be really key to the agility component, because we see that when we're talking about agility, we're not just talking about change of direction, but we're also talking about change of direction in response to a stimulus. So defender, going back and forth as the basketball is being passed between teammates or otherwise. It could be a DB trying to break down before the wide receiver makes a cut on the route. In any of these situations. So we try to make sure that especially a field sport athlete is exposed to sprinting, short sprints, and also agility. We typically will utilize a Exos numbering guide for our movement skills. So this helps us in the context of phase 1, 2, and 3, but it helps us to identify where an athlete fits. So number 1, that's going to be somebody that's like in phase 1. Phase 1 is going to have to include very low impact movement preparation and maybe some wall drills, maybe some sled drills that are not risky and are just concentric based movements. Phase 2 is going to be where an athlete is starting to be exposed to more technical based movements. So if I were using an example of change of direction or agility, well, if they were on number 1, they wouldn't be doing change of direction or agility. But what they could be doing is a wall drill or a sled pull. Because they're using the same muscles that would be then utilized in an agility type situation, but they're doing it safely. A phase 2 athlete would be doing, from an agility standpoint, maybe a low intensity cone drill. A low intensity cone drill would just be like, hey, I want you to run 5 yards and then slow down, right? Maybe it's, I want you to go from a shuffle to a shuffle side to side. You'll see some of these videos come up in our next couple of slides, but I'm just trying to give the example of it's more technical based and it's more cone drill based. Number 3, that's going to be inclusion for all pre-programmed movements, but we're still not doing any sort of reactive change of direction. So a reactive change of direction would be if I had like an athlete shuffling side to side and I was telling them, hey, I want you to cut this way, don't cut this way, don't cut this way, right? That would be how we would include reactive change of direction. So a number 3 athlete is moving in that direction away, like towards their ability to be able to do reactive change of direction, but they're not quite ready yet. They're still needing to do what we call predetermined movement, which is the beginning and the end. It's not a mystery to you. Whereas number 4, no restrictions. They have the ability to both do high intensity movements as well as reactive drills responding to external stimuli. This is a really important system that we utilize that help us to identify what restrictions an athlete has, not only relative to their injury, but relative to their timeline, and also relative to what the doctor's orders are. So how do I do this? Well, let's say we're doing our acceleration day outside on the field. Acceleration, just for terminology's sake, we're talking about short sprints, the ability to go from 0 to 60 really quickly over short yards, right? Like 5 to 15 yards. And so I have a system that we'll utilize between plyometrics. Their different movement skills, their speed work. And I need to make sure in one group at one time, do I have phase 1 athletes doing this drill series? I have my phase 2 athletes doing this drill series. And I have my phase 3 athletes doing that drill series. These drill series are based on managing that acute to chronic workload, where I then have the ability to say, hey, this athlete's allowed to run. Where's my starting point? These athletes are restricted from impact, so they need to be doing different type of wall drills and different types of running drills that don't overexpose them to. These different phases here, they help us to identify where does an athlete fit, and you'll hear me say this over and over again because my goal is that it's so abundantly clear how you can bucket these athletes that you can do it yourself. You can reach out to us if you need help with that, but also maybe improve what you're already doing with your athletes and also in your rehab scenarios. Do the same thing from a training perspective in the weight room. We have a very specific program. You should have a very specific program. Shouldn't be, hey, we're doing this today and maybe we'll throw this in tomorrow. No, have a system. Have a system by which you train your athletes, especially when you have so many different people, especially if you're like an athletic trainer. You've got all these different athletes in your training room. Like you have to be able to identify what's that system? How do I be consistent? This is your training plan. So create a training plan that you've segmented this way that helps you split up muscle groups. It helps you split up movement patterns. You do squats on certain days. You do bench press or single leg deadlifts on one day. You just have to come up with what your system is. This is our system. This would be an example of what a day 1 training program would look like. I have my phase 1 group, my phase 2 group, my phase 3. This is how I'm manipulating the environment over a 9 to 12 week process. You'll see here, this is actually 11 weeks. So this is about 11 weeks of training. They're going to accomplish a lot during that time period as it relates to building hypertrophy or muscle mass, increasing their strength, but then also improving their ability to operate on one leg, right? Typically in my program, especially when I'm working with ACL, reconstruction, rehab type athletes, they need to be doing a lot of single leg training. What we know is that quad or that hamstring, especially if it's a patellar graft versus a hamstring graft, it's going to be really weak and it's going to be not as tolerant. We might need to do more work on that. Now we've arrived at this spectrums piece. So normally this would be the point where it's like, all right, this is hands-on practical time. We're going to talk more about that. So you'll see the flow of this is going to be, we're going to talk about plyometrics. We're going to talk about what drills we're going to do, and then you'll see the videos. So get ready for that kind of format to kind of be there for the rest of the presentation. So in this model, what I want you to gather from these 3 slides are, how do I identify where an athlete fits in the spectrum? That's number 1. Number 2, what are some progressions that fit that model of where an athlete might be? And then phase 3 of this portion is, let's actually see the videos as if we were doing it like a practical workshop. So the principles and the stimulus for how do you know, how do you assign a plyometric drill, a jump drill, a box jump drill, a hurdle jump drill, a hop drill, any of our plyometrics that we do, how do you identify where to start and what to do? Well, we have low impact situations and we have high impact situations. Using a low box is very different than using an 18-inch box. Very different than using, as we've seen probably on YouTube, like those 60-inch box jumps that some people. Are we trying to encourage a two-leg environment or a one-leg environment? Are we doing a two-leg plyometric or a one-leg plyometric? Obviously, with a one-leg plyometric, I'm going to have more force, more stress going through the joints. So I need to make sure I'm being very smart about that and identifying, is this athlete ready for that? And I won't go over all of these, but hopefully what you can see is, like, for another example, is that am I doing something that's low velocity or high velocity? A low velocity situation is going to be better for a phase 1 type athlete, whereas a high velocity situation is going to be of a phase 3 athlete. What I mean by low and high velocity would be if I had an athlete do a single leg box jump to 6 inches versus I had them do hopping continuously for 10 or 15 yards. Those are two completely different situations, and those fit different athletes. And of course, understand the importance of progressing from linear to lateral to rotational type plyometrics. We're going to go over a few of these drills. I'm not going to delve into this too much, but once again, what's your system? How do you identify when to use a certain plyometric drill for some athletes versus others? How do you progress from different planes of motion versus sets and reps and high impact, low impact? Use this, and I'll kind of pause on this slide so you can, if you're watching this online, you might pause it for a moment so that you can kind of take a look at this. Normally we'd give a handout or something like that, so just kind of pause here for a second and just take a look at this chart. Let's go into what does that actually look like. Okay, so these checklists are just going to be probably the 3 simple drills that we do the most of that allow you to progress these athletes appropriately. So see here we have a 6-inch single leg landing, right? That's going to be part of one of our single leg plyometric progressions. I can go from a linear plane movement to a lateral plane movement to even a rotational based movement, right? And you'll see in my video here that my single leg landing wasn't great, but that's just to show that like as simple as that drill looks, it is pretty tough. So right now I'm using a 6-inch box. This is part of our 2-leg progression, right? That's a pretty simple movement. Most athletes in phase 1 can probably do that, a little bit of our phase 2 athletes. And then essentially they're going to progress into lateral box jumps. What am I trying to do? Well, once you've mastered the linear plane, you have to work into the lateral plane. And then how do I work into a rotational plane, right? Is an athlete going to have to land and decelerate and change directions and rotate? Absolutely. Well, I have to make sure that I'm progressing my plyometrics just in the same way that I progress my running program, in the same way that I progress my change of direction program. So those boxes can increase in height. They can decrease in height. It just depends on the situation, depends on the athlete. It's going to be a video of me using hurdles into my plyometric jumps. So same exact example. I'm then jumping over a hurdle before I then jump to the box. There we go. So I can use 2 hurdles, 3 hurdles, 4 hurdles, 1 hurdle. I can use big hurdles. I can use tiny hurdles. Same progression. I'm starting with linear movements, lateral movements, and then rotational movements. So this isn't exactly, this wouldn't occur on one day, or it wouldn't occur over just 1 week. This would be multiple phases in one. So just understand that once I've mastered a certain range of motion, I've mastered a certain plyometric, I can move on to a different plane. I can increase or change the sets and reps. There's a multitude of things. Now we're going to move on to that movement skills piece. When it comes to movement skills, it can be quite complicated. It can be quite intense. So what I want to kind of work through here is I want to just talk about that when we do our movement skills, we have to understand the progression and we have to understand the environment. These are some of those instances of us trying to create a certain environment. So here's us going to be talking about our linear acceleration progression. And this progression, once again, I'll kind of pause for a moment just so you guys can look through it. You can pause the screen, do what you need to do. But this is going to be how we progress our athletes back to running. We're typically going to start with sleds, banded drills, etc. And then we're going to move into what we call our 10 by 10 protocol. You'll see this happen on the next few slides. But we're trying to introduce athletes to running mechanics with simple low impact drills. And then we're progressing to more force, more power, more explosiveness. And this is going to increase the amount of impact that they're doing too, right? Because they're going from 10-yard sprints to 20-yard sprints, right? And then our phase 3 kind of starts into longer sprints between 15 to 30 yards. It's going to be high impact. It's going to be explosive focused. It's really going to be like, it's going to be intense, right? But that's why we have to progress the athletes to that point. Because you're going to think about a football athlete. Let's say we're talking about a wide receiver. Are there times that an athlete's going to have to run 90 yards? Absolutely. There are times where they're just going to run 5 to 10. Yeah. But you need to be able to teach that athlete how to accelerate for longer distances. That's where our speed work comes. So in our drill practical, once again, we would go outside, we would do marching, skipping, running, all these drills that we're about to show you. I would encourage you to definitely, on your own with a friend or some of your athletes, feel free to kind of experiment with something. This is going to be our basic linear marching drill. We're just focusing on, all right, how do you get your body down and under yourself? And how do you drive your knees up, right? What does your posture look like? What do your arms look like? How does everything coordinate well together? And then we're going to focus on more of the skipping pattern, right? This is a really good drill to start teaching introductory power, coordination, and explosiveness, right? While also exposing the athlete to the amount of impact that actual running would look like. We do a lot of marches, we do a lot of skips with our initial athletes. Then this is a little bit more of an advanced progression. It's literally like a running drill where you are running against the band. What we like about the band is that the band actually reduces load and it actually allows you to move through a more full range of motion. It's not resistance as much as it is assistance. So it always allows our athlete to really practice limb mechanics while they're running in a progressive approach. Then typically we will focus then on banded sprints. Now, you might think this is a really intense drill and an intense exercise, and it can be. It depends on the size of your band. It depends on how hard you're being pulled, but it does allow you to start to introduce sprinting back to the athlete in a really safe way. And for us, this is also going to allow us to focus on technique and form. Can you run wrong? Yes. Can you hurt yourself running? Absolutely. We have to be able to teach the mechanics and the technique of running different drills. And then eventually we go into a situation like this, where we're going to focus on short 10-yard sprints as part of our return to sport, return to running program. So this is me doing a 10-yard sprint. What I'm going to do is I'm going to set out some cones. And as athletes are returning to running, they're going to go through multiple rounds of drills like this. I'm not a fan of using jogging or the treadmill as a way to return athletes to running, because especially for a field sport athlete, they need to be able to sprint. And you'll see on the next slide, I believe I have that you guys can look at. So this would be an example of how do we progress that athlete over time? How do we progress that athlete from these different drills, utilizing the same subset of drills and progressing that over time? So we have phase 1, phase 2, phase 3, phase 4. Once again, I'll just pause on the screen here just so you guys can take a moment and kind of take that in. I know it's a lot, so I encourage you definitely to pause the screen, take a moment to kind of look through that. I'm going to try to fly through this because I'm sure we're getting close on time. But what I would like to do is I would like to kind of go through our change of direction, progression. Lay out your drills this way. Lay out your specific progressions this way. I'm not saying that you guys have to do your drills this way. What I am saying, though, is that you should assign exercises a certain level, and you should have a certain progression that you're thinking about, right? And that should be the case for everything we've done, and hopefully you see that by now. But once again, I'll pause on the screen, make sure that you can take a moment to kind of take this in. Go to the next slide. So these different practicals are going to help us to identify agility drills that we can do with athletes based on level. So we're going to just focus on a few of these. We aren't going to put all of the videos in this one, but what I want you to see is our shuffle progression. So our shuffle progression here is going to be us utilizing call this a push to base drill. The athlete is pushing against some external resistance. Well, this is the first thing that we do when we teach athletes how to shuffle, right? Shuffling in sport is a very defensive strategy, and for us, we have to make sure that we're doing it in a safe environment, especially the first time that we do this. So we'll typically do a very slow, low intensity, resisted lateral walk like this. We call it a push to base. It's going to be the first thing that we get. The idea behind that is going to be us kind of taking this quick step, just like you see it here. And that quick step is going to embody a little bit more of a cutting mechanic before we actually need to cut at a high intensity. So every athlete will always have that kind of quick motion, whatever an athlete has to change directions. But that kind of lower intensity environment, their ability to practice and really work on their form is going to be how we can progress them over time. And then this becomes kind of that higher intensity drill. Now, you're going to see me kind of cutting side to side a lot faster. I have to reserve this for more of my advanced athletes, but it is something that you need to be very good with and very exposed to throughout the training process. Because if all you do is just weight room or all you do is just movement skills, you're always going to be missing something. That's why these progressions are really important for returning to sport, because you're exposing them to their environment in that chaotic environment that they might have to do on the field, and they might have to do that multiple times in a game, hundreds of times in a game. We have to make sure our training process matches. Assuming I have about 5 minutes left, so we're going to go ahead and just kind of finish out here. We have our change of direction spectrum here, and this is going to be a similar focus as the shuffle emphasis. So before we were focusing more on shuffling, this is going to be more rotational type movement. So where I'm actually cutting and then actually changing directions. So in the practical, you'll see the crossover to base, the crossover reposition to base. Crossover sprint. Let's look at that quickly. One of our former coaches, Sam, doing an awesome job here showing us a crossover to base. So this crossover to base is a lot more of that rotational plyometric. And that rotational plyometric is going to be really key for how do we teach the change of direction rotational mechanic. We typically will reserve a lot of our change of direction work for athletes post 6 months. So a lot of this is going to be this sort of like phase 2, phase 3, and they're kind of blending together. But just like in the first situation where it's very static and then I would change directions, this one's going to be a little bit more of that dynamic environment where they're doing a little bit more of that quick change of direction with a little bit of that quick step. You kind of see that there in the video. Right, and we've covered a lot of ground. And let me just say this much. I have tried my best to simplify these different drills so that you guys can see them. But ultimately, there's going to be a lot of different things that fit into this program. You'll see here, this is me doing a crossover sprint. This would be another kind of higher level change of direction drill where even in the future, I might have an athlete run into the line, cross over, and change directions. So these are just kind of some of those basic foundational elements of teaching the crossover mechanic, which is what you see in sport all the time. And this is how we begin to expose the athlete to those different movement skills. Okay. So when it comes to the last phase of our program, we're talking about this strength training. This could be a talk in and of itself, even just these points right here. So what I want to touch on is that when it comes to your strength training program, this is the last portion of our talk today, just to round everything out. So we've talked about the plyometrics spectrum, we've talked about the speed spectrum, we've talked about the agility spectrum between shuffling and crossing over. The final area, the final place is in what we're actually doing in the weight room. So when it comes to the principles and the stimulus involved in strength training, we have to make sure that movement quality is first. I mean, that's the most important. You need to be able to squat well, hinge, squat, RDL, lunge, have good core strength. You need those things before we start to layer in volume, before we start to layer in load and intensity, before we start to layer in speed. So you need to be able to identify how you're going to create the environment around your strength training. What stimulus are you trying to provide? You know, one of the most important things that we do is we do single leg strength, because we know that there is a significant deficit on the leg that has had surgery. And so we ultimately need to make sure that we're targeting that weakness and that deficit. But as you've seen throughout the talk, we have this phase 1, phase 2, phase 3. We don't have the time to really talk through all of these components, but what I do want to highlight is I do want to say, hey, pause the screen, take a look at this on your own time. And what I want you to do is I want you to kind of notice that on this phase 1 side, we're almost using single leg almost exclusively, because we know that we have such a deficit to overcome. So we're going to use things like lunges, single leg squats, single leg deadlifts, single leg glute bridges, single leg curls, because we have one side that needs to be. So we're going to typically do a 2-to-1 ratio of our surgical side to our non-surgical side. So just meaning that if I have 3 sets of 10, I'm going to do 10 on the surgical side, I'm going to do 10 on the non-surgical side, and then I'm going to do 10 again on the surgical side. So I'm literally doing double the amount of work on one side relative to the other in order to help it catch up and get stronger. From a hypertrophy perspective, I'm going to start layering in more intensity. I'm going to layer in more tempos to help encourage time under tension. And from where we were before, where it's like 3 sets of 10, I'm going to start playing around with our 4 sets of 8. We're going to introduce trap bar deadlift. We're going to introduce barbell RDLs. We're going to introduce more exercises to our strength training routine while still maintaining a 2-to-1 work to rest ratio, or not work to rest ratio, surgical to non-surgical ratio. And then in our phase 3 component, I'm going to start to include more of our traditional power lifts. So back squat, deadlifts, RDLs, split squats, and single leg RDLs. Those are going to be the things that we need to continue to utilize to drive maximum strength through that kind of phase 3 approach. And of course, the hope is that that would continue into that phase 4. But ultimately, that's going to be the place that we take the athletes using 3 sets of 5, 4 sets of 5. And you'll see that that ratio slows down a little bit. This is the point in the rehab and performance perspective where it's going to start catching up. And what you don't want to do is you don't want to overcorrect for the problem that you initially had. So you're going to slow down. Maybe I only do 1 extra set on the surgical side and just make that difference. So in summary, these are the 3 points that we discussed before. Chaos is the thing that we have to return our athletes to. Our training approach has to think about that and consider. Hopefully, you're able to utilize this opportunity to take what we've learned today and utilize it in any return to play scenario where you are reverse engineering from what are the demands needed of the sport. And last but not least, we have our progression spectrums for plyometrics, speed, agility, and strength. Please go back to those sections of the video, pause it, do whatever you need to do. And it's how we manipulate the environment. It's how we ensure that the acute to chronic workload is in our favor. I will let our MC kind of go through some questions if they have them. Don't? Cool. Here's our here's my email, here's our Instagram page, and then if you are actually utilizing your phone, this is a QR code to our childrens.com/sports performance page. You can learn more about us, more about what we do, and ultimately get in contact with us. So thank you so much. I appreciate you guys coming to this. Thank you.